let me ask you this. According to our reports, there are 2.3 million private charitable organizations, almost all of whom receive no federal funds. But do you know how many receive 41% of their funding from the taxpayers?
I don't know how many see as many patients as we do. We see 2.7 million patients a year.
Do you know of any other private charitable organizations that are receiving 41% from the government or 528 million from the taxpayers?
Well, again, I think the fair comparison would be who's seeing 2.7 million patients, because as I said earlier, we don't get a big check from the federal government. We actually are reimbursed for services delivered, for birth control, for STD testing and treatment, for well women visits.
Well, I can tell you that almost every one of those 2.3 million charitable organizations would, I'm sure, if given the opportunity, would tell us that the government or taxpayers benefit from what they're doing also. And just to give you an example, the National Boys and Girls Club in their clubs in their last annual report said they received $26 million from the federal government compared to your $528 million. It seems a little bit lopsided to me.
I think the cost of providing health care to 2.7 million people, and I very much respect the Boys and Girls Club, but we are actually we work like hospitals and other health care providers and being reimbursed directly for services that we provide. Again, I think the comparison is a little apples and oranges.
Let me ask you this. Do you think it's right in a free country to force people to contribute to your organization? Because that's what you're doing, taking taxpayer money from people that are totally opposed to what you're doing.
We provide health care under the Medicaid program, just like every other hospital and health care provider that sees Medicaid patients. And I think one of the things that's important to understand is in many areas there aren't new doctors or healthcare providers that will see Medicaid patients. And particularly when you're talking about OB/GYN services, it's not always easy for women, and particularly in the southern United States, to find someone who will actually provide them a well woman visit, birth control services.
Let me ask you this, because my time's running out, but I know you apologize for the discussion and the tone and maybe the laughter. I don't know whether you apologize for the laughter or not on the videos, but I'm not clear on this. Do you defend the sale of baby body parts?
No.